Understanding the complexities of human behavior can be daunting, especially when it comes to distinguishing between narcissists, psychopaths, and sociopaths. These terms are often used interchangeably in popular culture, but they refer to distinctly different personality disorders, each with different underlying causes, pathologies, and behavioral traits. This video explores all three disorders and how to distinguish their differences. Narcissistic personality disorder is characterized by an inflated sense of self-importance, a deep need for admiration, and a lack of empathy for others. Narcissists often believe they are superior and have a grandiose perception of their abilities and achievements. They crave attention and validation, often going to great lengths to maintain their self-image. Key traits include arrogance, entitlement, and a tendency to exploit others for personal gain. Narcissism can be rooted in a combination of genetic, environmental, and psychological factors. Research suggests that genetics play a role, as individuals with a family history of narcissism are more likely to develop the disorder. Additionally, environmental factors, such as excessive pampering or harsh criticism during childhood, can contribute to the development of narcissistic traits. Psychological theories also suggest that narcissism may stem from underlying insecurities and a fragile self-esteem that individuals attempt to compensate for by adopting a grandiose self-image. The pathology of narcissism revolves around the need for constant validation and admiration to sustain an inflated self-image. Narcissists often lack genuine empathy, making it difficult for them to form deep, meaningful relationships. Their behavior is driven by a desire to maintain their self-perceived superiority and to avoid feelings of inadequacy or vulnerability. This can lead to manipulative and exploitative behaviors, as they prioritize their own needs and desires over those needs and desires of others. Unlike narcissism, psychopathy is a more severe and complex disorder, often associated with a profound lack of empathy and remorse, superficial charm, and manipulative behavior. Psychopaths are known for their calculated and predatory approach to relationships and social interactions. They can be charming and charismatic, but their actions are driven by an almost overwhelming need to control and dominate others. The causes of psychopathy are believed to be a combination of genetic and environmental factors. Studies have shown that there may be a hereditary component, as psychopathy tends to run in families. Neurological research indicates that structural and functional abnormalities in the brain, particularly in areas related to empathy and impulse control, may contribute to psychopathic behavior. Environmental factors, such as childhood trauma, abuse, or neglect, can also play a significant role in the development of psychopathy. The pathology of psychopathy is characterized by a profound lack of empathy and an inability to form genuine emotional connections with others. Psychopaths often exhibit a superficial charm and manipulative behavior, using these traits to exploit and control those around them. Their actions are driven by a desire for power, dominance, and gratification, with little regard for the consequences or the impact on others. This lack of empathy and remorse allows them to engage in harmful and destructive behaviors without feeling guilt or shame. If you're struggling, remember you are not alone. Millions face similar challenges, and it's okay to not feel okay. Therapy can be an invaluable tool for support. Online therapy offers the benefits of traditional therapy, but is more affordable and entirely online. Sign up today and connect with a licensed therapist within 48 hours from anywhere, for phone calls, weekly video meetings, and 24/7 messaging. Join over 1 million people and take charge of your own mental health, and you'll get 20% off your first month with online therapy by using the link in this video's description below. Sociopathy, also known as antisocial personality disorder, shares some similarities with psychopathy, but is generally considered to be less severe. Sociopaths tend to exhibit impulsive and reckless behavior, with a disregard for social norms and the rights of others. They may struggle with forming and maintaining relationships, often displaying a pattern of deceitful and manipulative behavior. The causes of sociopathy are multifaceted, involving a combination of genetic, environmental, and social factors. Genetic predispositions can play a role, as individuals with a family history of antisocial personality disorder are at a higher risk of developing the disorder. Environmental factors, such as exposure to violence, neglect, or inconsistent parenting during childhood, can also contribute to the development of sociopathic traits. Social influences, including peer pressure and exposure to criminal behavior, can further shape an individual's propensity for antisocial behavior. The pathology of sociopathy is characterized by a disregard for societal norms and a lack of remorse for harmful actions. Sociopaths often engage in impulsive and reckless behavior, driven by a desire for immediate gratification and a lack of concern for the consequences. Their relationships are typically superficial and exploitative, as they prioritize their own needs and desires over the well-being of others. This lack of empathy and remorse can lead to a pattern of deceitful and manipulative behavior, making it difficult for them to maintain stable and meaningful relationships. While narcissists, psychopaths, and sociopaths share some overlapping traits, such as a lack of empathy and manipulative behavior, there are key differences that set them apart. Narcissists are primarily driven by a need for admiration and validation, with a focus on maintaining an inflated self-image. Psychopaths exhibit a more severe lack of empathy and remorse, with calculated and predatory behavior aimed at gaining power and control. Sociopaths, on the other hand, tend to engage in impulsive and reckless behavior, with a disregard for societal norms and the well-being of others. Be sure to check out the link in this video's description to get 20% off your first month with online therapy. If you or someone you know is in a toxic relationship with a narcissist, you need to watch this next video. See you there.